Hi, it's Dr. Kate Utek back for a video on bladder retraining. So this is a really useful tool if you did your bladder diary and you analyzed your bladder diary and you found that you're having urinary urgency, urinary frequency, urge incontinence, then this is going to be a really valuable tool to help you address those symptoms. So if you have no idea what I'm talking about, I want you to go find the video on filling out your bladder diary, and then the video on analyzing your bladder diary so that you'll know where to start and how to address these symptoms for yourself. So bladder retraining is a behavioral tool that we use to put you on a schedule for urination. By doing that, we can reteach your body to help your bladder stretch before sending you those strong urges that you need to rush to the bathroom so that you can hold more urine and you can urinate less frequently, and that it's easier for you to hold that urine in on your way to the bathroom. So, few steps with bladder retraining. When you're looking at your bladder diary, I want you to look at what is the shortest interval that you urinate at. So if you have intervals where you're urinating every hour and a half, and that's the shortest that you're really going, then you would start with an hour and a half bladder retraining program. If you have intervals at an hour, then you're going to start at an hour. We want to start where you're going to see success so that you know that you can do this. Okay. So once you figure out what interval you're going to start with, then you're going to start urinating on that schedule, exactly on that schedule. I give people plus or minus 5 minutes, but really trying to hold to that schedule. That may mean rescheduling other things in your life for a period of time to meet this schedule. So you're going to set a timer on your phone, and when the timer goes off, you're going to go to the bathroom and reset the timer so that it goes off again at the same interval. And that's going to remind you to go every single time, okay? Whether you have an urge or not, you're going to go sit on the toilet and attempt to urinate. If you feel the urge to go to the bathroom before your scheduled time, you're going to use what we call urge delay techniques. So you're going to stop what you're doing, sit down, distract yourself, take some deep breaths, and you're going to contract your pelvic floor 5 times. Squeeze and relax, squeeze and relax, squeeze and relax. That's going to directly signal the bladder to calm down, cool off, and that you're going to wait and not go to the bathroom. By doing this, you're telling your bladder that you're in control. This should calm that urge down and give you a chance to reteach your bladder that you are in control and that you're not going to listen every time it says immediately and go running to the bathroom anymore. If you get a second urge before your scheduled time, then you're going to use the same techniques, but this time your goal is just to calm down that urge and get it under control so that you can walk to the bathroom. It's not your scheduled time, but you want to walk there, not run. So you're going to, again, stop what you're doing, distract yourself, take some deep breaths, and contract your pelvic floor 5 times or so. Then you're going to walk to the bathroom, go to the bathroom. You are still going to urinate at the scheduled time. So if you were scheduled at 8 and you went at 8 and you were scheduled to go at 10, and at 9:15 you got your first urge and you were able to delay it, you were able to calm that urge down and move on with your day. But then 15 minutes later at 9:30, that urge came back and you calm down that urge and you walk to the bathroom. You're supposed to be waiting until 10. You're still going to go at 10 o'clock because this starts that retrains your brain that your brain is in charge, not your bladder. And it helps to remind your body that you were going to go so that you know that you can help your bladder and your brain understand, if your bladder had its own brain, that you are not going to make it wait or 6 more hours. You were going to go a half hour later, and then you were going to be reasonable. So a couple things that this bladder retraining really helps to do. One is it helps to make sure that your conscious self are in charge of when you go to the bathroom. So you're going to wait if it's too early, and you're going to go on your terms when you go. And then you're going to reiterate to your body that you would have gone at a reasonable frequency if it was getting a little too stressed and a little too pressing in its urgency, that it was communicating that you needed to get to the bathroom. So a few tips that can really help are to do the bladder diary through this, or at least some sort of a bladder log to help you record when you went. Using the timer is another technique that really works well for a lot of people, and making some slight adjustments to your activities in your schedule to match your urination schedule for right now. So how do you progress this? So you can increase the time interval between urinating once you have achieved about 4 days, sometimes 3, in a row without any leakage and without needing to urinate prior to the scheduled time. It's okay if you have a little urge that you get under control by using those urge delay techniques, and it calms down and then it doesn't come back and you end up going on the schedule. As long as you go on the schedule, it counts as a good day that counts towards this 3 to 4 day count until you can progress the program. If you start at an hour or an hour and a half, you're going to go up 15 minutes. Okay. Once you get to 2 hours, I find most people can go from 2 hours to 2.5 hours, and from 2.5 hours to 3. Each step you have to wait until you are at that step for long enough that you get 3 to 4 days without any leakage and without any times that you have to go to the bathroom early. Once you get 3 to 4 days, then you can move up to the next level. So again, an hour, hour and 15, hour and a half, hour and 45, 2, 2.5, 3. Okay. So depending where you're able to start on this, you could be doing the whole bladder retraining program for a number of weeks. I find that typically people will find that they use about a week to get used to each stage before they're really ready to move up to the next stage. But if you're starting at 2 hours, it'll just be a couple weeks before you're at 3. And no matter what, at each stage, you're urinating less frequently and you're in charge of when you're going a little bit more. Couple last tips are: make sure you are not doing any just-in-case voidings. You are going on this schedule, only on this schedule. You're not urinating before you go to the store every time as well. You're just going when it's the scheduled time to go. You're also going to don't consistently go before you get, or as soon as you get to your destination. Again, that's just in case voiding. We're not going to do that. You are going just on the schedule, and hopefully it'll work for you. It should. If you have any questions or you need further advice or help, then get in touch. Let me know. My company is New Journey Physical Therapy, and my website is www.newjourneypt.com. You can reach out there. You can find me there. And I hope that this helps, and I hope that you're able to, improve some of your urgency symptoms. Thank you very much for watching.